you. Thank you, sir. Thank you. As we all know, digital health applications definitely is going to improve. Digital health applications are going to improve diabetes management. We all are doing it. We all are doing it. And I think so. Just I'm going to present what I am doing at present, and that is happening in our country. What is happening in our country? So, what are the key benefits of using digital health application? We all know real-time data tracking, that is apps can integrate the glucose monitoring devices to provide continuous data on blood and sugar levels, allowing patients to identify trends and make informed adjustment at their diet and medication regimes. Then medication adherence, nowadays also we have reminders so that people don't forget medicines. There are apps. Lifestyle coachings are there. Apps can offer personalized education and guidance on health, eating, exercise, stress management also. Stress management also apps are there. Improved communication with healthcare providers. Some apps allow seamless sharing of data with doctors, facilitating more informed treatment decisions. Increased engagements, definitely. As we know that interactive features and gamification nowadays, there are gamification apps. In games only the children are learning how to manage type 1 diabetes. There are games. Can motivate patients actively manage their diabetes. Second, what are the examples at present which we are already using? We are using carb counting, meal logging, tracking carbohydrate intake, manage blood glucose level by apps. Exercise tracking is very vigorously done by everyone. Everyone has an app in the on your wristwatch, which is you are observing day by day. This is technology which we are talking. Already we are using. Just we are not experiencing it very nicely. Then insulin dose calculators we all are using, assisting insulin dose adjustment based on blood glucose levels, blood pressure monitoring, and that is tracking blood pressure alongside diabetes management, and metrics are there. Then community support, connecting people with peer groups. The supports are there, apps are there which connect you to your peer groups. Now from overhead starts my own, and this is for the first time in the history of world we are discussing these slides. So I have created this is as your and my digital clinic. So it is 8x4 system of diabetes digital clinic which we should have in our clinic to have better managements. There are 8 points: patient engagement, health analysis, AI, wellness, then biosensing variables, telemedicine, health information exchanges, then home care and cloud computing. And these all 8 parameters have 4 parameters to be taken in care of. That is, first of all, patient engagement. Computers are needed, mobiles are needed at both patient and doctor's end. Proper patient counseling regarding digital platform and tools are there. Regular doctor patient participation digital platform has to be done. Making EMR app available in patient's mobile. 4 points. Next, health analysis, AI. Motive is to collection of analysis data so that further if you want to do some clinical researches also, these data can be accumulated. Enrolling each patient at digital platform with unique ID. Requesting the old available medical records for patients in adequate history. Encouraging patients to use EMR app at fullest for appointment of and self-monitoring data. Feeding at regular intervals. This has to be educated. Education about apps will be easy. Next most important thing is wellness. Develop your own digital clinic app so that you are not disturbed. Your distress is not there and you are less overburdened if you are going to customize the app for your users. Development of digital clinic owns exercise app. Development of digital clinic own QR codes which will be encoded with the regional language for education of diabetes management. Development of digital own emergency management protocol which is missed by several clinics. You have to have a protocol app, some number, so that people in emergency can go through that app and can reach to the emergency treatments. Then biosensing variables, we all know BP, definitely. Pulse oximeter, temperature, ECG, biosensing gadgets, non-invasive continuous glucose monitor, we have already discussed. AGP, SMBG, automated BMI machines are to be used also. Then telemedicines, which we have been using in COVID-19 very nicely. Each and every one has used this and we have saved n number of lives. So we are techno savvy. Now India is evolving in technology by #1 in position all over the world in adapting very fast. We are very fast adapters. Then health information exchange. This is important wherever you go. Now in India we are having Aadhaar cards being developed. So you will be having your whole data on that card itself. Wherever you will be going, you will be presenting that card and each and everything will be in the app, your all history, your all references, and you will be connected to all the doctors. So this is already happening in our country. Then home care. Home care application apps can also be there so that food physicians, food technicians, insulin pump educators, diabetic educators are connected at one platform itself. Then cloud computing, this is important. by virtue of which we say that these applications may have a problem. So we have to log these things in email, data storage, backup data, retrieval, then creating testing apps, analyzing data, data security, and private cloud must be used to pull all in one data storage with multiple tasks and EMR apps. And whenever we are using, definitely we have to have a permission done. This is my summary. Digital health application can significantly improve diabetes management by providing features like blood glucose monitoring, medication reminders, personalized education, dietary tracking, active logging, and communication healthcare providers, which can lead to better self-management and provide improved glycemic control and overall improved diabetes outcome with the patient. With this, I want to end my talk. Thank you. 8x4 Diabetes Digital Clinic is the solution. Napo to jano.
You can see how Saurabh was in distress to reduce our distress. He was delivering his words with what speed? Great. But really, he has done his great effort. I would invite Dr. Arun Shankar to put his points.
You had talked about mobile, so now we are using cover to protect it. We are using cover.
Telediabetology. So Dr. Arun Shankar is medical director and consultant diabetologist at Jyotidev Diabetes Research Center in Trivandrum. He is alumnus of Government Medical College Aleppi, chief coordinator of diabetes telemanagement system at JADC. That is, you know, Jyotidev's. So he is the person behind it. Investigator of various clinical trials, and he's got a lot of publications in international journals of telemedicine, insulin pump therapy. He's a GC member of RSSDI Kerala chapter and joint secretary of IMA Nimon branch. Over to you, Dr. Shankar, to put your points.
Thank you. Thank you.
It has distressed you too much, is it?
Yeah. Only myself and my academic director was there to raise the hand. Yeah. So good evening, respected chairperson and dear friends. At the outset, let me thank dear Banshi sir and the entire Diabetes India Ahmedabad team for this opportunity. And after Saurabh, I'm finding it very difficult. And that too coming from a center where we are practicing more of technology. So, like we are seeing more patients who are using technology, but at the same time, we have to take care, or we have the concern of discussing the other part of the coin as well. Yeah. So, sorry. So the digital health application explained very beautifully by Dr. Saurabh. You have the wide range of technology, including smartphone apps, website, wearable devices, online platforms, where the patient themselves and the entire treating team is interacting to help the patient to get over their diabetes management properly. So monitoring blood glucose levels, tracking medication adherence, promoting healthy lifestyle choices, and at the same time facilitating communication with the entire diabetes team. But on the other side, you have to address patients' concern when they are using these gadgets, modern gadgets, the diabetes distress which we are seeing among our patients. I'm sure you all will agree, even though you haven't raised your hands, the emotional distress, or the one, including the depression and disease-specific depression distress which we are seeing among our patients, which has a negative impact on their diabetes treatment outcomes, that has been clearly shown. There is frustration, they're more worried, guilt feel, sadness related to demands of self-management, fear of complications if not properly managed and if not addressed, and the impact of diabetes on their daily routine life. So these are all the apps available. Different category. You have nutrition apps, physical activity apps, glucose monitoring apps, insulin titration apps, insulin delivery apps, and the automated insulin delivery system, which was discussed in the earlier session as well. So the argument 4 was discussed clearly by Dr. Saurabh. You can have an improved blood glucose monitoring with the usage of the entire apps available for your patient. At the same time, with enhanced education, you can motivate your patients very well. But what is the evidence? The statistics clearly shows that there is inconsistent results being observed with the usage of apps. Studies evaluating the impact of DHAs on glycemic control have shown that there is mixed results, with some showing modest improvements and demonstrating no significant difference compared to the conventional treatment. So if at all you have some benefits with the usage of these apps, it is short-lived. So many a times after a short period of time, the users lose their interest and they encounter more of technical difficulties while using this technology, modern technology. And individual variability, again, the motivation level of the patient, the technical literacy and access to support is very important. So, the risk of over reliance of technology and data, the patients are more relying on technology and the data which is being bombarded on them. That results in loss of intuition. Many a times they are not able to recognize the alert symptoms or alert signals of the body. So the data that is being bombarded, the excessive data can be overwhelming and confusing, leading to decision fatigue, and many times they won't act after seeing this much of high sugars or many other parameters using this apps or technology being used when they are managing diabetes. That technical failure which is happening while using these apps, the technical glitches, the data breaches and the software updates that can disrupt self-management efforts. So the psychological burden, the increased level of anxiety and stress which we see among our patients while using these applications or the digital revolution which we are discussing right now. From the day one itself, the patient is there with you. And we are asking them to monitor blood glucose regularly. Let it be with the SMBG or the modern sensors which are available for our patients. We are asking to monitor regularly, fasting, postprandial, post-lunch, post-dinner, 3 a.m. Any time you are having hypoglycemia. So they are confused. They are again having a fear or anxiety while doing this monitoring, and fear of judgment, self-blame. When sugars are not getting controlled, they are blaming themselves. So some among these patients are again obsessed with the data. They want more and more data to confirm whether sugars are getting control or not. Here again the distress happens. So like what I said, from the day one of diagnosis, the patient is with you. The chronic disease, diabetes is being managed throughout their life and you are along with them. So there is lack of personalized support and human connection. Automated responses in these apps often rely on automated messages and generic advice, failing to address individual needs and preferences. So thereby creating an emotional vacuum. The personal relationship with the patient, the professional healthcare team involved in the diabetes care, if not being done in the proper way, it can create problems. Again, limited context, the DHAs may not capture the complexities of individuals' lives, such as socioeconomic factors, cultural beliefs, and emotional well-being, which was again discussed by Saurabh. So the disparities which we see and the access of technology which we are concerned about with regard to affordability, but sabke saath sabke vikas means there in future we can have more of the people using affordable devices or gadgets for such treatment. So in the internet access and the digital literacy, yesterday we had a patient, a lady homemaker above the age of 60. For the last more than 10 years, she is getting treated at our center. She is well off, but she is not interested in monitoring sugars with sensor. Even though she required the regular monitoring of blood glucose levels, she was not willing to go for that. And again, ethical consideration, which was discussed earlier in the earlier sessions as well. The patient is giving lots of data to these apps. So we are concerned, and they have to be more vigilant, and they should know, they should give the consent, and we should know what the data being used in future as well. So there is the ethical consideration is important. So to conclude, the need for balanced approach and further research is needed with regard to the usage of any applications, any number of applications which are available in market or in patient care. The DHA's whole promise for improving diabetes management, definitely that, but the over reliance on technology and data can lead to psychological distress, which we discussed right now. So a balanced approach is needed. That is the combination of the benefits of DHA with personalized support, human connection, and a focus on individual well-being should be there while you are using the DHA. Further research is essential to evaluate the long-term impact of DHA and identify strategies to mitigate potential risks. Thank you.